And here we go. Welcome everybody to another episode of The Big Idea. I'm your host, Dr. Jeffrey Hanna here at Clear Chiropractic, where we talk about the big idea. What is the big idea? It's how a small bone at the base where your head meets your spine can affect your health, your well-being, your quality of life. And if we can make changes there, it can improve your quality of well-being. It can improve the well-being of your family, your community, potentially even the world. And what we're going to be talking about in this particular video here is something that you only do about a third of your life. That is sleep. Emphasis on quality sleep and how it is that out of all of the different things that can contribute, that when something may not be sitting well in the upper part of your neck, that can be that missing element that's preventing you from being able to actually rest, recuperate, recover from the various stresses that happen over the course of the day. So let's get into it, show you what's going on here. And first up, we always start with the story. The story is that we go through life all of the time experiencing numbers of physical injuries. Slips, trips, falls, small car accidents, whiplash injuries, things like that, where there's not necessarily broken bones and there's not even bleeding, but there can still be damage on the inside. And in particular, where we're looking at the health and the well-being of your spine, the weak point and the most critical part is this area here that's at the very top of the neck. It's your C1 and your C2 vertebrae. And what these do is these actually act as tension cables that provide basically all of the movement of your head in order for your brainstem to be able to communicate properly with the rest of your body. And the problem is if we have these subtle little injuries where these vertebrae can shift and lock out of position, even by a couple of millimeters, over time, what that's going to do is that's going to accumulate stress and strain on your body. You see, we're born 100% perfect. Your body's designed to win. But what happens is as these stresses accumulate over a period of time, what they do is they slowly reduce your overall quality of life. And the things that we often put down to, it's just stress, or I'm getting older, or there's nothing that I can do about this, I just have to learn to live with this, that is not necessarily true. Instead, it can be very much the consequence of these unresolved issues in our bodies. And so what do we do from the upper cervical chiropractic standpoint? We don't do twisting, we don't do cracking, but what we do is we take a very personalized approach for an individual to find what is the true nature of these injuries. How is it that these vertebrae have locked out of position? And by restoring their normal movement, the normal alignment, and their overall stability over a period of time, what that does is that allows for your body to start to be able to heal and repair, going back toward your 100%. And as that happens, that improves blood flow, that reduces tension, that brings a sense of calm and ease back to your body so that it's able to work the way that it is designed. And because these top two vertebrae in your neck are so important and they influence so many different centers of your brain, they can show up in all kinds of different ways that we never think are actually associated with that part of the body. It's not always about pain. And what we're going to look at now is how it is that sleep can actually be influenced by the alignment of these particular vertebrae. All right, and what we have here, we have a little diagram of all of the various centers of your brain that are actually directly in the firing line if and when these vertebrae are not aligned. And I'm not going to go through all of them in this particular video, don't worry about that. But there are two centers in particular that I do want to emphasize and I want to highlight for you right here. The first one is this little guy here, located in the purple. What this is called is the rostral ventral lateral nucleus. What this is involved with is with what's called your sympathetic action. Sympathetics are a specialized division of your nerves that control the dilation of every single blood vessel in your body. And not just the body, but also the brain. And so when you have this kind of issue that could be affecting this area, if you're having altered blood flow, it's going to activate what's called that fight, flight, freeze system. And what it does is it can produce a series of, physiological changes that essentially can lock the body into an abnormal state of heightened awareness. In other words, a sense of angst, anxiety, agitation. And even if you don't feel any of those different things, if that's affecting you at a physiological level, guess what that does? That has the potential to increase your stress hormones. And as a bit of an aside here, particularly as it relates to sleep, one of the most common beliefs that we have in our modern medical system these days is that what the problem is that our body is not producing enough melatonin. So melatonin is a hormone that's released from a higher center in the brain. It's called the pineal gland. And what's it involved with is it increases over the course of the night. It's believed that, well, not just believed, it's essential for you being able to sleep. However, there is what's known as a diurnal effect. And so what it is we have we have a normal relationship that needs to be maintained between two different kinds of hormones. The melatonin, so that you can rest, but also the cortisol, which is your stress hormone, which is going to be necessary for you when you are awake. And what's commonly believed is, what the problem is if I'm not sleeping well, I must not be producing enough melatonin. And so you can go get melatonin supplements and all different kinds of stuff like that. That's good. That's great. It's wonderful. Helps a lot of people. But a lot of people, it doesn't help. And so what I'd like to propose here as a possibility is if you've got an issue that's affecting your brainstem, affecting those sympathetic centers of your brain, it's not the melatonin that's actually the problem. The problem is that your body is locked in this sympathetic state. And as a consequence, your body is producing too much cortisol. And even when you're trying to sleep, guess what? That cortisol doesn't actually diminish the way that it's supposed to. And the consequence of that is even if you have the right amount of melatonin, it's insufficient to actually allow you to have a good quality night's rest. Now, if you take the melatonin in that circumstance, because your body and your brain, they're not stupid, it's going to say, okay, whoa, now we've got an imbalance of the hormones. We need to actually increase more cortisol in order to accommodate that balance like that. And unfortunately, what this can do is this can start to set up a positive feedback cycle where essentially the more melatonin you're taking, the more cortisol that your body produces. And as a consequence, that imbalance just perpetuates. So if melatonin is actually the problem, yes, that will solve the issue right then and there. But if melatonin is not the problem and the problem is potentially these sympathetic nerves, guess what? What you actually need is you need less cortisol, not more melatonin. So that's scenario number one. Now, scenario number two, this is the one that I've highlighted now in pink. And what this pink cluster of cells is known as the dorsal motor nucleus. Sometimes it's also known as the allicin area. Name doesn't matter. What this is this is actually the twin pair. This is what is known as the primary parasympathetic division of your nerve system. What this is this is that part of your brain that is responsible for rest, repair, digest. This is what produces that sense of calm, that sense of ease in your body. And it's also essential so that your heart, your lungs, your digestive, your reproductive systems are able to work the way that they are supposed to. So we always have this balance between sympathetic and parasympathetic. So same issue here is because this cluster of cells is potentially in the firing line, if and where you ever have that vertebra that's locked out of position, putting a neural stress on your brainstem or producing abnormal blood flow in this area, you can have this agitated sense. So that sympathetic goes up and that parasympathetic goes down. And even when you are trying to normally sleep, that imbalance persists. The consequence of that is you can have trouble falling asleep. You wake up too early. Your body is just never in that physiological state that's actually necessary for rest and repair. And what will happen then is, yes, you can go to bed, but you don't wake up feeling any rested. You wake up thinking, I'm just as groggy as when I had gone to bed here. This is not a good thing. And yes, again, there's always the opportunity where a person can take a sedative or something like that to just sort of knock you out. But the thing about it is if you have to take a medication that's just simply going to knock you out, if that imbalance persists, guess what? All you've been done is knocked out. Your body was not in the state to actually do any proper amount of rest and repair. So we can understand here then, again, that if there's an imbalance of these autonomic nerve centers in your brainstem, potentially coming from a misalignment in the upper part of your neck, that is going to inhibit your body's ability to get a proper night's sleep. Now, even at this point, there is a little something that's important for me to say. For me to be, on the camera here right now and to tell you that, oh yes, what we're talking about here, the different brain centers and how these misalignments in the upper part of your neck, that's the cause of your sleeping issues. That's simply put, that's not true. And the reason that it's not true is because you can have a lot of different things impacting your sleep. Yes, if you have a lot of stuff that's on your mind. Yes, if you have some type of hormonal imbalance. Yes, if there are things that are in your environment that are triggering allergic responses, so whether it's dusts, molds, different chemicals in the environment, things in your laundry detergents in terms of your pillows and all that. EMF also has a big impact on this. Any number of these different things can affect your quality of sleep. But again, if you've been looking for solutions, you've been doing and you've been trying all of those different things, but you're still not getting that breakthrough that you're looking for, what I'm proposing here is this possibility that it can be coming from an area of your body that you've never previously considered. In other words, sleep is multifactorial. There's more than one thing that can be going on at any given moment in time. But this nevertheless represents an irreplaceable and essential element. In other words, is if you've got that problem in the upper part of your neck, you can have all of the relaxation tapes, you can have all of the hormone balances, you can have a pristine environment, but things are still not going to be working right the way that they should be. And so you need to have a look here, see what's actually going on. Now, I've got one more slide just to torture you with just a little bit of neurology here. I don't expect you to make heads or tails out of all this, but this is simply illustrating all of the nerves, the electrical wires that control and coordinate everything in that essential upper neck region. And the one that I have highlighted in the bright yellow, these are the nerves that come out of the level of the C1 vertebra. So that area right up at the top of your neck. And where these nerves go, amongst other places, is they go toward the muscles that actually control your airway. And we know this because I work in conjunction with a lot of musculoskeletal dentists, so TMJ experts as well, because we know that the orientation of your jaw is going to have a profound impact on your airway. As a very basic little experiment, what I would have you simply do is this. What I'm going to have you do is kind of give yourself as big of an overbite as you possibly can. So you're trying to essentially shove your jaw backward like this. And even if it's through your mouth, go ahead and take a few breaths like this. And tell me how easy that is. Now, what I want you to do is the exact opposite. Jut your jaw forward like you're a bulldog giving yourself an underbite and breathe a few times like that. And what you're very likely going to notice is that it's easier to breathe when your jaw is forward. So what the TMJ specialists and what are also known as myofunctional therapists to work on the surrounding jaw muscles to help to relax them is that the structure and the orientation of your jaw has a profound impact on your ability to breathe. And you can appreciate then that, okay, if you are not getting adequate amounts of air as you are trying to sleep, what that can do is that can start to produce turbulence, irritation, and this will commonly manifest as snoring or as a obstructive or as a non-obstructive sleep apnea. In other words, even though you are trying to sleep, what's happening is you're having these micro interruptions all the way through the course of the night. And yes, you can always have a CPAP machine, But all that's really going to do is that's basically going to be trying to shove the air down your throat. But if the opening there has been constricted because of jaw position, then you're still going to have these same kinds of limitations. And again, you will not be waking up feeling very restful, very well rested at all. Now that's the structural side of the equation. So what I wanted to highlight here with this particular diagram is that the nerves that come out of your brainstem, these are the electrical wires that control how well these muscles can actually work in the first place. So even if you do not have a TMJ or a jaw or a dental related issue, it can manifest producing the same symptoms. Why? Because those muscles are chronically tight. If you've got any problem in your body, I want you to imagine I'm poking you in the arm, kind of like this. Well, what's going to happen is the muscles are going to reflexively tighten. And if it so happens to be the muscles involved with swallowing, involved with speech, and your ability to breathe itself, guess what? You're not going to be getting enough air over the course of your night. And as a consequence, you're not going to be feeling very well rested in the morning. And this is one of those key and essential things I often talk about. I've done a number of videos also on TMJ and the overlap between what's happening with your jaw and what's happening in the upper part of your neck. It's that some of the most difficult people who I work with personally, that is, they're not fully responding to the upper cervical work. What they actually need is they need to work with a musculoskeletal dentist and a person who is working with the dentist, but the process is being very slow. It's not quite going exactly as we hope. It's very likely because there's some kind of an issue in the upper part of the neck that's causing those muscles to be excessively tight. And if you can allow them to be fully relaxed, taking the pressure off, it means that that dental work or that work that you're having done to help improve the myofunctional activities that you're doing, that can go towards improving your overall quality of sleep. In other words, going with the current rather than trying to go always against it. Now, I'm not just proposing this as a hypothetical here. There's actually been some research that has been done on this as well. And this one here comes from back in 2008, Drs. Welch and Boone. What they were doing is they were doing a few different measures, not so much of sleep per se, but they were looking at this relationship, as we already talked about, between the sympathetics and the parasympathetics. Again, it's that neurological balance that's essential for you to be able to get a good quality night's sleep. And they were measuring it in terms of blood pressure, what's known as pulse pressure, what's known as heart rate variability, measures of both sympathetic and parasympathetic activities in the body. And what they wanted to see is okay, is there any evidence out there that different levels of the spine can actually influence these autonomic centers? In other words, is it possible that a precise chiropractic adjustment can offer more than just pain relief, something like that? Now, this is a relatively small study, but nevertheless a very important one because it illustrates exactly what is possible. So, what they did, and I'm just going to jump straight to the conclusion here for you, it is preliminary suggested that cervical, the neck, adjustments may result in parasympathetic responses, whereas thoracic adjustments, the middle part of your back, result in sympathetic responses. Furthermore, it appears that these responses may demonstrate the relationship of autonomic responses in association to the particular segments adjusted. Now, what does that mean? It means that even though it's not always a linear relationship in the body, it means that certain areas have more profound influences in terms of helping to restore our autonomic levels than other areas. And if particular emphasis, what they're saying here is they're saying that it's the neck. And I don't know whether they were, focusing in that C1, C2 area as much, although there is other evidence that says, yeah, that's the real powerhouse here, is that what that does is that when you are looking at where you have an imbalance, where the sympathetic is too high and the parasympathetic is too low, that when you work on and when you make a correction in the upper part of your neck, what will actually happen is you will see a reversal of that. You will have the activation of the parasympathetics, the rest, the repair, the digest, and you will have the deactivation of the fight, flight, freeze responses. And when that happens, you can appreciate if your body goes into that state where it's more likely to have rest, repair, and digest. When do you think that your body is most able to make those activities? Guess what? It's when you're sleeping. In other words, by adjusting the upper part of the neck, it has the potential to shift your body's physiology into that state that promotes a healthier and more recuperative sleep. Now, I've tried looking for it, but I can't find it, unfortunately. Out in Western Australia, apparently many, many years ago, they had a survey that was done among a bunch of chiropractic offices. And they wanted to find out what was the number one most common thing that their clients, that their patients noticed after starting care. And they were expecting, okay, yep, I've got less tension in my shoulders, or I have fewer headaches, or less pains in other parts of my body. But interestingly, the number one thing that was reported was that people said, I am sleeping better. And in fact, we see this very, very commonly in practice. It's that when you have that successful correction, a person actually starts to yawn. It's as if there's that change that's occurred in the physiology, and immediately their body is shifting into that state that facilitates rest and repair. It's one of the reasons why it is that when we actually will do an upper cervical adjustment, we don't want a person to just get straight back in the car facing all of the rest of the stresses in the day. It's like, no, no, no. Take a few minutes and lie down. Have a rest. Give your body even a brief little window for where things actually have that opportunity to do the necessary rest and repair. And in fact, it's very, very common where what people will report then back to us is that they start feeling very tired, that they need to have a nap in the afternoon, that especially it's the first adjustment and their body has been locked in this abnormal physiological state for a long period of time, that they just need to go to bed super early. So it's like you've had a very busy day, and finally, whatever was causing the issue has been able to be let go of so that the body can actually do the necessary healing and repair. So a little bit anecdotal, but I've seen it time after time after time after time, is that when you are able to take that pressure off that upper part of the neck, off of the brainstem, to where your brain can start communicating with your body the way that it's designed and can start to repair the damage, to restore the normal harmony, the normal balance. The consequence of that is that a person is able to actually heal, repair, and very interestingly start to sleep an awful lot better. Again, there's a lot of factors that go into a quality night's sleep. But if this is one of those unexplored possibilities here, you're having trouble sleeping, you've been diagnosed with a sleep apnea, you're snoring, or you're waking up in the morning and just not feeling as well rested as you believe that you should be, I ask the question, is it possible that you may actually have an undiagnosed problem in your neck, an area you never would have thought is actually associated with sleep that could be the issue? All right, and thanks for watching this particular video. As always, we hope that you found it both informative, but also gives you hope that there is another possibility, an opportunity here where you can improve your overall health, well-being, quality of life. And so if that's the case, there's 4 things that we ask from you. Number 1 is please do like and subscribe to this channel. That way, this information is more likely to be found by other people who need to find it as well. Number 2 is if you have friends and family members who you think would benefit from knowing about this information, please share it with them. Number 3, you can go to my website, which is drjeffreyhanna.com, where we've got all kinds of other blogs, articles on how it is that the upper part of your neck affects your health, your well-being, and can change the quality of your life. And you can also reach out to me personally if you have any particular questions, suggestions for the channel right here. And last but certainly not least is if you're listening to this and thinking, okay, I'm ready to make that change to improve my quality of sleep and other things in life. You can reach us at our practice, which is clearchirospokane.com. You can give us a ring at 509-315-8166, and we'd be happy to have a chat with you, find out what it is that we could do to help you out. Thank you guys again very much for watching. This is your host, Dr. Jeffrey Hanna at Clear Chiropractic Spokane. Get well, live well, stay well. So until next time, take care and bye-bye.